Active Training Systems.
So next up, we've got Dr. Rori Alter. So now I've been working with Rori since 2000. Check the paper. Yeah, 2015. And it didn't take long after that, and she started helping us with our injured lifters, helping them get back to healthy lifting again. And I know that that's been a huge asset for our team, just to have a place for lifters to go where they can get the kind of help that they need. You know, powerlifting is a rough sport sometimes, and sometimes injuries happen. And, you know, we feel like if we break them, we ought to put them back together. So she's definitely helped us do that, and it's been really important. So it's been a big component of what we do. Now, as a lifter, just like Ross, Rory's just fresh off of Raw Nationals as well, and she also did awesome. She had a 4th place finish overall in the 72 kilo class, had a PR bench, deadlift, and total. So just like Ross, you're seeing her today as the best powerlifter she's ever been. So that's pretty cool. Now, in addition to helping us with our injured lifters, she runs her own company. Let's see, I've mentioned. Haven't practiced this, obviously. So just the help with the injury thing is probably the biggest thing that she does for RTS, but she's also a coach in her own right, and she helps lifters, even non-injured lifters, get stronger and set PRs. Again, that's the thing that ties us together. That's the thing that we're all after, and that's the most important part of this. So injury being a big concern for lifters, a lot of us can find ways to get stronger, but it's those setbacks that, you know, that keep you treading water for long periods of time, years even. So avoiding those and getting past those is a big deal. So today she's going to be talking to us about injury risk reduction and just how to prevent those things before they even start. So again, taking up too much of your time, so by all means.
Thank you so much for that introduction. And thank you all so much for being here and for coming back on day 2. Like Mike said, I'm Dr. Rori Alter. I'm a physical therapist and I own Progressive Rehab and Strength. It is a remote and in-person coaching and physical therapy practice. I'm a clinical athlete provider, which is a network of clinicians, chiropractors, doctors, physical therapists, massage therapists, who are also athletes in and of themselves. So if you're ever looking for a provider who understands your sport, clinicalathlete.com is the place to go. You can find someone local who specializes with athletes. I'm also a competitive powerlifter, and I do the injury management for RTS. My certifications include active release techniques. I'm full body certified, and I'm also a starting strength coach, which is really where I developed the foundation for the technical execution stuff that I work on with my lifters. So in today's lecture, we're going to first talk about what an injury is and how they happen. Then we're going to discuss 3 things in powerlifting that you can do to reduce your injury risk exposure. Then we're going to talk about how and when it's appropriate to train through injury and pain. We're going to briefly touch on soft tissue work and mobility and its efficacy in injury risk reduction and injury management. And then we're going to talk about a hot topic in powerlifting, especially in female powerlifting, stress urinary incontinence, which is kind of more prevalent now than it's been in the past. And then at the end of the presentation, we're going to talk about how to find a professional who understands your sport and isn't just going to tell you to stop lifting if you're injured. So I want to start today's presentation with this quote. There are 2 things that everyone who trains with weights will have: soreness and injuries. Who's experienced both of those? Okay. If you work hard enough to improve, which we're all here to improve and set PRs, you will work hard enough to get sore, and eventually you'll work hard enough to get hurt. And I actually liked, Paulie made a little reference to crossing the street and that there's a sign that says start or stop and go. You know, when we cross a street, we look both ways before we cross so that we see if there's a car coming in either direction to reduce our exposure to getting injured crossing the street. But at the same time, a car can come from out of nowhere and injure us. So when we're training, we can take measures to not get injured, but we can also be exposed to something random or that we don't have control over. So if you've trained long enough, if you have that, you know, I think in the study that Mike did on personality, the training age was about 8.5 years. The longer you've been training, the more more exposure you've had to hurting yourself. So I want to also talk about the demographics of the people sitting here in this room, just to kind of relate all of this stuff to you in here. So all of you took a survey before you came here this weekend, and we had 29 responses. So what I want to point out is short-term injuries. So something that's taken you out of training for 4 or less weeks. 17% of you have never experienced a short-term injury, okay? 83% of you have experienced an injury that's taken you out of training for 4 weeks or less. And those injuries are mainly to the low back, hip, and shoulder, okay? We've also had a question on long-term injuries, which is something that takes you out of training for 4 or more weeks. 48% of you have never experienced an injury taking you out of training for a month or longer. 52% of you have been out of training for more than a month due to an injury. So this is a really relevant presentation for all of you, okay? And the injuries that take you out the longest are related to the low back and hip. And then we also had a question in there for the female lifters who took the survey, and 60% of the women who took the survey have experienced at some point in their training or lifting career urinary incontinence. So we're gonna get into that a little bit at the end of the lecture. So, what's an injury and how does it happen? Well, an injury is something that happens to the body that can cause pain in a way that's not the normal consequence of correctly performed exercise. It can be acute, meaning there's a direct insult, you know exactly when it happened. You have an acute response, swelling, pain, redness, burning, or a chronic injury. You can't really define when it happened. Over time, you kind of had this nagging pain and it just kept getting worse and worse. Okay, so how do injuries happen? Well, there's 3 ways in my clinical experience that I've noticed injuries come about. Improperly executing the lifts, so that's technical execution. There's something that you're doing in your lift execution that's not optimal for your movement. Carelessness or lack of focus. How many of you have injured yourself on a warm-up set? Okay, a lot of you, okay? So we warm up with the bar, 135, 225, 275. And we go through the motions, we're not really thinking about it. We might have our music on, talking to our training partner, and tweaked my back. We weren't focusing. So we need to treat all of the lifts exactly like our heavy sets. So focus, paying attention to what we're doing, we'll get more into that. And then programming. So in the presence of all of these other things, if your programming is not appropriate for you, specifically for you, we might take all of these things together or one thing individually, get mechanical failure of a bodily structure, which can lead to an overuse injury, which is like a tendonitis, tendinopathy, or stress response, or an acute and sudden injury, a tear, a fracture, herniated disc, what have you, okay? So the first thing we're gonna talk about is lift execution. So this is technique. So to reduce the risk of injury related to technical execution, we have a couple of things that we wanna look at. We look at our bar path. We wanna maintain a straight bar path and even distribution of the load. So a straight bar path means from point A to point B, the movement of the bar is straight. There's no zigzag, there's no curve, there's no swoop, it's just straight, okay? And we also want to make sure the load distribution is even. We don't want plates sliding off to one side. We don't want the bar set uneven. We don't want the bar twisting when we're lifting. So we want to make sure everything's equal and even when we're lifting. We also want to pay attention to what our joints and our body segments are doing. We want our joints to unlock at the same time, so we don't want to see our hips shoot back before our knees bend. We don't want to see our knees straighten before our hips start to straighten. And we want all of our joint segments to move at the same time and at the same pace, okay? Additionally, we want to minimize extra accessory motion of the joints and segments involved in the motion. The two things that I like to point out when I talk about this is on the bench press and the squat, we don't want our elbows moving all over the place. If our elbows are moving all over the place, the bar can roll and we can hurt our elbows and wrists. But what this all boils down to, and all of the rolling, the joint unlocking and locking at the same time, and the body segments moving at different paces can affect your bar path. Okay? Deviations of the bar path from a straight line introduces additional and unnecessary forces that can lead to extra energy expenditure for the body to correct the error. And that leads to your tissue damage, your mechanical failure, and physiological failure, which then leads to acute, or could lead to acute or chronic injury over time. Okay. So additionally, in addition to all of those things that we just talked about, I like to talk about the joints that are not involved in actually moving the load. So the joints that are not involved in moving the load are still affected by the bar. And what we want to do is take stress off the joints that aren't involved. So we want to maintain a neutral position of all of these joints that aren't moving. So if you look here, this is the spine, okay? And then you have the neck, the cervical spine, which is an extension of the spine also. So you have this extension right here, okay? And then you also look right here, the forearm and then the hand. So you have extension in the wrist. And then if you look over here, we have a straight line between the head and the spine and the wrist, the hand and the forearm. So we don't have any extension or flexion of the wrist and the neck, okay? And then another example is a straight wrist and an extended wrist. So typically you'll see some wrist, elbow, and shoulder injuries when you have an extended wrist, all right? Okay. The third thing that I like to talk about is eye gaze. So it's really important what we do with our eyes when we're lifting, because our eyes are an extension of our spine, our spinal cord and our brain, or so our nervous system. And our bodies tend to follow what our eyes do. So if your eyes are moving all over the place, your balance is going to be off, and your awareness of your environment is going to be off. So we want to find a particular focus point that we set our eyes to and keep it there while we're lifting, so that we have very good awareness of our body in space and the space that our body is in. So our eyes provide feedback to the lifter about our position in the environment, and it helps to maintain a straight bar path. So remember, we talked about injuries happening because of deviations from bar path. So if our eyes affect our bar path, then we want to make sure our eyes are doing what it's supposed to keep a straight bar path. And it provides feedback about the position of the bar. So in the bench, we can utilize our focus point and our peripheral vision to know where the bar is in space rather than looking at the bar, okay? So what I like to tell people is in the three main lifts, and then I like to talk about the fourth power lift as the overhead press, our eye gaze should be a perpendicular line from our neutral spine angle. So remember, we talked about having our spine, our head, and our back in alignment, so a neutral spine, so not extended or not flexed. So our eyes are going to be a perpendicular distance to wherever our spine is, okay? Okay. So I'm going to first talk about low back injuries, because those are like it's the biggest realm of injury that we see. So how do back injuries happen in powerlifting? Well, they happen with loaded spinal flexion, loaded spinal hyperextension, and loaded spinal rotation. So in the survey that I sent out, 34% of you experienced a low back injury that took you out of training for 4 or less weeks, and 24% of you experienced a low back injury that took you out for 4 or more weeks. Does anybody know or remember how they hurt their back? No? How did you hurt your back?
One time I was just coming up from the squat and I felt something like shift or something. I probably should have done it, but I like finished the squat, and finishing it made it like a lot worse than it could have been.
Okay, and anybody else?
For me, I was doing a single, and then I didn't get as tight as I normally do, so then I was pulling up, pushing.
Yeah. Has anybody hurt their back like with mixed grip or anything like that? Okay, so mixed grip is going to be the loaded spinal rotation. So whenever we see our spine position change while we're moving under load, that's typically when we get back injuries. So this is a squat good morning. So that's going to be, our hips go back before our knees start to bend. So we get the bar forward of the middle of the foot, which causes a flexion moment on the back. And here we also see flexion, which is, this is like butt wank or going too low, ass to grass. Our low back relaxes at the bottom of the squat. And here, this is a pretty round back when we deadlift. If you ever see, you start in a flat back and then all of a sudden as you lift, your back just like turtles. Yeah, that's never good, okay? And then also, a lot of people overemphasize lockout. So overemphasizing lockout can really hurt your back over time. So that's probably one of the biggest fixes that I make for those like insidious onset low back issues at lockout, is that the person's overemphasizing their lockout and they're aggressively locking out the bar. And so they're slamming their low back into hyperextension at the top of the deadlift. So that's a common injury that I've seen. Now I just want to, actually before I go into that, so loaded spinal rotation. So who here uses mixed grip? A lot of people. Now, do you use mixed grip on all of your sets from like the warm up to the working weight? Anybody do that? 1, 2, 3, 3. Okay, so I'm gonna challenge you to use double overhand for all of your warm-up sets until you can't hold on to it anymore. So typically you're like second to last or last warm-up set before your work sets. And the reason why is because if we're always using mixed grip when we're deadlifting, we're not developing our back muscles equally. So typically if a person comes in for an evaluation, and that's like one of the, I always ask that question about mixed grip during an evaluation, and then I'll look at their spinal musculature development and I'll see a big uneven development from side to side. So what we can do is we can start using double overhand for all of our warm-up sets, and those warm-up sets begin to strengthen our low back or our musculature a bit more even. And on your supplemental or accessory work, use straps so that you're maintaining the double overhand position. Your grip's still gonna develop. If you're using your regular grip for your working sets, you're fine in terms of your grip strength. If there's, you know, obviously if you're like some other issue with grip strength, then that can be addressed with programming, but double overhand or straps for accessory and supplemental work, just so that you can develop evenly across the whole back. And then of course, with mixed grip, that reverse grip side tends to get away from you. So that's spinal rotation with flexion. And that's like a recipe for disaster. Okay, so that's low back injuries, but I also just want to talk quickly about if your low back injury is really, really bad, or not just your low back, any spinal injury. There are some red flags because a spinal injury can get really bad, and this is what you should do, or how you should recognize a very bad injury that needs medical attention immediately. So if you have muscle weakness or atrophy in either your upper or lower extremity, so whatever leg or arm is feeling the symptoms, you notice that it's weaker or your muscles are atrophying, get attention immediately. If you have prolonged pain without relief, so typically, when left alone, orthopedic injuries kind of heal and subside on their own. If the pain is not subsiding, get medical attention immediately. If your pain is excruciating, now excruciating is excruciating. Like think of a shark biting your head off. I'm not talking about like you stubbed your toe or you have a general ache in your low back. I'm talking about true 10 out of 10 pain, like you're about to die if you don't get medical attention. That's 9 to 10 out of 10, okay? Go to the ER. And if you have loss of bowel and bladder function. So if you notice that you can't control your bathroom habits, or so you might like wet yourself and you're like, how did that happen? That's a problem. But not the urinary incontinence that we're gonna talk about in female powerlifting, like really truly just wetting yourself without even feeling that happened. Or you realize that you haven't gone to the bathroom like all day or for 2 days, then you need to get medical attention immediately, because that can be a big problem with your spinal cord. And so now we're going to talk about the hip. So typical injuries develop in the hip based on a few things. Stance width, so too wide or too narrow, can cause different types of impingement in the hip. Can also lead to your knees tracking in the wrong direction. So that can lead to medial collapse. So that leads to loaded internal or external rotation at the hip joint, which is never good. We want to keep our knees in a fixed position and not let them cave in or push out too far while we're squatting. A squat good morning is when you break at the hips before the knees. And that can put pressure on the back of the hip and the front of the hip, and it leads to knee slide at the bottom of the squat. So knee slide is when the knees continue to travel forward more than they should at the bottom of the squat. When the knees travel too far forward at the bottom of the squat, we get an increase in the hip angle and pinching in the front of the hip, which can lead to overgrowth of the bone over time. So if this happens for a very, very long time and you've never addressed it, you can get overgrowth of the bony structures in the front of the hip. You can tear a labrum, you can get impingement of the hip flexors, and it can just lead to a whole host of pain. And then if we have, like I said before, medial knee collapse, so the knees caving in, this is medial knee collapse. If you have the knees caving in, that's loaded internal rotation at the hip, and that can pinch the labrum, okay? So soft lockouts, so if you notice, like every time you finish a squat, you're here, your hip and your knees are always in flexion, and there's always tension on the musculature in the hips and the knees. So always lock out. Give your joints a break at the top of every lift. And then in the deadlift, also particularly if we find that your stance is way too wide, we can have groin injuries, we can have adductor injuries, and also impingement in the front of the hip, the medial front of the hip. So I like this one. I've actually seen, it was like 2 years ago at IPF Worlds, a girl was like probably, how tall are you? 4'9". Yeah, she was like 4'9", and she had toes to the bar sumo stance. Like, that's too wide. Like, I get it. Like, I get that you want to move the bar as little as possible, like the shortest distance to lockout, but at the expense of what? Sliding and tearing your groin or catching your toes under the bar, you know? So find the stance that's appropriate for you, in sumo particularly. Not everybody should do toes to bar, and there's coaches who run around saying, go as wide as possible, go toes to the bar. But if you're 4'9" versus 6'1", where do your toes go? You know, like, should they have the same stance width? I don't think so. Okay. So for the shoulder and elbow, I typically see the two biggest issues in terms of injuring your shoulder or your elbow in the squat and in the squat would be your grip width, so being too narrow, and having your wrist extended. Now this is going to vary from person to person because not everybody has the same mobility in their shoulders. Not everybody has the same amount of muscle on the back of their shoulders. But typically you want to take a neutral grip. So you can see the difference actually here. So this is my girlfriend Katie Ann. She takes a very, very, very narrow grip and a thumbs around grip. And her wrists are in extension and her elbows are under the bar. So her elbows and her wrists are taking load from the bar. Then over here, this is me. You see that I have a thumbless grip and my wrists are in neutral and my elbows are back and away from the bar. So I've taken my arms out of the equation. All I'm using my arms for is to stabilize the bar against my back, okay? So again, this grip width, how far you can get your elbows up, and how tight and how comfortable you feel is dependent on the person, but play around with it and see what, you know, if you're having elbow pain, if you're having wrist pain, maybe try something else. So not everybody's gonna get elbow pain from having a narrow grip. Some people will. So if you do, if it ain't broke, don't fix it, but if you start to develop the elbow pain, play around with your grip. Also, bar position. So if the bar is set, so there's low bar squat. I think most people here do low bar squat, right? Raise your hand. Pretty much everyone does low bar squat. Now there's low bar, and that's when the bar is set too low for low bar and it starts to slide down your back while you're lifting. When it starts to slide down your back, it extends your wrists, it can hurt your skin, and it can hurt your elbow and your shoulder. So we wanna just make sure the bar is set just below the spine of the scapula. So if everybody takes their hand and reaches back, you'll feel a bony ridge. Does everybody feel that? You don't wanna put the bar on it. You want to put the bar just below it, okay? That you should be able to lock in with squeezing your shoulders up and back, elbows up and back, and pressing your hands into the bar. You should be able to create a nice shelf where the bar is locked in position. I was showing someone yesterday that I can hold the bar in position without my fingers, okay? So your grip shouldn't be like extremely tight on the bar. If you have to hold onto the bar so tight in order to prevent it from sliding down your back, something's wrong with your bar position and your grip, okay? Okay. Now, it's the same principles in the bench press, grip width, and elbow position, but applied differently for the bench press. So, again, you know, you have to kind of weigh all your factors here. Yes, in competitive powerlifting, we want to move the bar moving the bar a shorter distance, we can probably move more load. But at what expense? Injuring ourselves. So when we look here and we see this wide, and this isn't even a very wide grip. I'm sure everyone has seen a much wider grip in competition. But we see that this is a very open elbow angle. And if we look down here, this is a pretty narrow grip where we have a very closed elbow angle. Both of these positions can cause discomfort or injury to the elbow. The wide grip can cause injury to the pec, the anterior shoulder, and the bicep. And the narrow grip can cause injury to the tricep and the elbow, the wrist extensors, okay? So we wanna be careful with where we place our grip. Now, we also want to look at, so this is from the front or back view of the bench press, but we also want to look at it from the side. So we want to make sure that our elbows aren't too far forward or too far behind the bar. We want to make sure that our elbows are directly in line with the bar. And then we want to look at our head position as well and our eye gaze. So if our head pops up like this, first of all, that's not allowed in USAPL or IPF. But if you're in a federation where it does pop up like this, understand the implications that has for your shoulder. So when we pop our head up, we lose tightness in our upper back, our shoulders can round forward, and we can put a lot of pressure on the front of the shoulder, so the anterior structures, the AC joint, the biceps tendon, the supraspinatus, okay? We can get a whole host of issues that oftentimes I've been able to fix by keep your head down. Very simple fix, okay? And then again, wrist position here, we just want to make sure we maintain a neutral wrist when we're benching. Any stretch on the musculature that crosses the wrist will have an implication at the elbow. So by keeping that wrist in neutral, we reduce the possibility of putting stress on the medial or lateral elbow structures, okay? Okay, and I think this ties into a lot of what Paulie was talking about in terms of like being very conscious and aware of what we're doing. So this is the third thing, the second thing that I'm going to talk about in terms of managing reducing the risk for injury. Okay, so we want to make sure we're very focused and paying attention to what our body is doing while we're lifting. So we can use some internal and external feedback when we're lifting. Internal feedback is going to be our feelings, like exactly what we're feeling, not like, oh, I feel so wonderful today, but really how our lift feels to us. Did that feel good? Did that feel right? Did that hurt? Did I feel balanced? Did something feel off? Okay, and we can do this rep to rep and set to set. So between every rep on a set, we ask ourselves or say to ourselves, that felt good, or that didn't feel right, fix this on the next rep, and apply that to the next rep. And we can do that for the whole set as well, so set to set. So we want to be very conscious of what our internal thoughts are and be aware when we're lifting. We also want to use external feedback. So for anyone who trains at home, you can use video, record yourself, and I do this in the gym too, because you don't always have a training partner when you're at the gym. So using the video feedback to correlate with your internal feedback. Okay, so that felt really good, but that didn't look very good on video. So that's something that I need to take into account and apply to my next set. We can also use our friends, our coaches, and external sounds. So I like to use the deadlift as an example. So how many of you have been told to or try to take the slack out of the bar when they're deadlifting? A lot of you, wonderful. How many of you actually listen to your bar when you're, and I think that I probably told you, have I mentioned that to you in like any of your videos? To listen to your bar? No? So actually when people send me videos for review, I actually like watch with the sound on a lot of the times, because I use their sounds in their videos to say, okay, your bar made a lot of noise when it came off the ground. I want you to make sure that it doesn't make any noise, because if it doesn't make any noise, that means that you pulled all the slack out. And if perhaps on one rep, it made noise, you might know that you didn't get tight enough on that set, and you can get tighter on the set rep. You can get tighter on the next rep or set. Does that make sense? And then of course, lifting with friends. While a friend might not be a coach and they might not be an expert in what you're doing, they will be able to identify things that look like really bad and be like, that set did not look good, okay? And then it's always good, you know, to get up with a coach every once in a while who you trust in their technical execution and their coaching, and just have them look at your lifts, because we do develop bad habits. I'm a coach, I'm a doctor of physical therapy, but I try to train with my husband and one of our best friends. They're both coaches as well, they're both powerlifters. I try and train with them as much as possible because I fall into bad habits. And I don't always see that. So I will say like, hey, can you watch this set? Or give me feedback on this one, okay? And you wanna make sure that every rep looks the same, so every rep is repeatable, okay? If you do a set of 5 reps and not one rep looks like the rep before, then you don't have a rule book for your lifts. If you don't have a rule book, then you don't know what you're doing. Then you don't have anything to judge your perception of your lift against. So you just wanna make sure that even if you're doing it completely wrong, you might as well do every rep exactly the same, completely wrong, because at least you have some sort of idea what you're doing, even though it's wrong, you know? But if every rep just looks completely different, you have no idea. So you wanna take your videos and say, do these look good? Does everything look the same across every set? Okay? And cue yourself. In your head when you lift, you should always be thinking, always reminding yourself of at least one thing. A lot of my lifters say to me, there's just so much to think about. When we're like reworking a pattern or fixing something or teaching the lifts for the first time, it's so many cues, it's so many things to think about. Right, but for now, while we're creating a movement pattern that's good and pain-free and works for us long-term, yes, it's a lot to think about now, but down the line, funnel down the line, those thoughts, those multiple cues will become one thought squat, one thought deadlift, and it becomes your motor pattern and your solid movement and your repeatable movement from set to set, rep to rep. You also need to understand your body's limitation. So we like to say, well, so-and-so is the best bencher in the world, so I should bench just like him. Or so-and-so is the best squatter, so I should squat just like her. But everybody's different. Everybody has different injury history, in different flexibility and mobility. Everyone has different body segments. Some people are tall, some people are short. Everybody's different. So we have, I really like to use the bench example because everybody's like, I gotta get the biggest arch possible. But we can look at 2 of the best benchers in the world, Jennifer Thompson and Dennis Seary. And they actually really have like minimal arches. And wanna know why? Because they're probably very stiff in their spine. So they don't overarch. They don't have giant arches. You can't stick your whole head through their arch. But they have enormous bench presses. They have the best benches in the world. But their arch isn't huge, and their range of motion is longer. It's not 2 inches. You know, it's a normal range of motion. But that's because they understand their body's limitations, and they're not over aggressive in reaching something that their body's not designed to do. And then again, always think, even on the warm-ups, I asked you all in the beginning, how many of you have hurt yourself on a warm-up set? And a lot of you raised your hand. That's because 225, even though it's a warm-up, is still 225 pounds. We don't walk around with 225 pounds in our hand or on our back, okay? So we have to treat each rep with respect, each rep with thought, and each rep with purposeful execution in order to avoid injury at the light weights in addition to the heavy weights, okay? That never works for me. Okay, so the next thing that I want to talk about, so this is the third and final thing in terms of approaching an injury risk reduction, it's programming. So we talked yesterday I didn't want to give too much away yesterday in the Q&A, but we talked about intensity, fatigue, and injuries, and why I particularly like RPE training versus percentage-based training. So there's that gray area that I talked about yesterday. When you have RPEs or intensities in the 9 to 10 range over extended period of time, we develop a lot of fatigue, we develop form breakdown, and then we have the potential to develop injury, okay? So if we can manage our our fatigue over time, we can do a little bit better of reducing the risk of injury. So RPE training allows us to manage fatigue a little bit better. So 24% of you in the survey answered that you've had a back injury that has taken you out of training for 4 or more weeks. Whenever I have a client who comes to me with a back injury, I say, glad you feel great now, so happy we got to this point, but you will always be at risk for having a back injury. Wear your belt. It doesn't matter if it's easy stuff, well, 45 pounds, 135, but for all of your training sessions, for all of your working sets, put your belt on. Yes, there is the idea that only competition lifts wear your belt. Don't wear your belt for supplemental lifts. We need to train the core, get the core stronger. But down the line, if you hurt your back on a supplemental lift because you weren't wearing your belt, you can't even train your competition lift, and then you're out and you can't go to your competition, right? So just put your belt on, especially if you've had a back injury or multiple back injuries. You want to wear your belt when you're training for all of the lifts rather than just the competition lifts. And then we want to have a well-rounded program. So even though we're powerlifters and benching is our sport, we do want to spend time on strengthening through the full range of motion, so strengthening overhead, not just in the horizontal push, but the vertical push as well. So I didn't write the numbers down, or maybe I did. Oh, yeah. I didn't write the exact percentage, but I asked the question about how often you guys overhead press. Most of you put 1 time a month or less. A month. Okay? So what I recommend is at least overhead pressing, if you have the available range of motion in your shoulders, overhead pressing at least 1 time a week, and actually training the overhead press to be strong through the full range of motion of the shoulder and not just the horizontal range of motion of the shoulder. And then we also want to balance our pushing motions with our pulling motions. So about 50% of you bench 3 to 5 times per week, but 50% of you perform upper back pulling motions less than 3 times per week. So if we have this high frequency of horizontal pushing and low frequency of horizontal or vertical pulling, then we don't have equal balance of the muscles on the front side and the back side of the shoulder. And that can lead to injury down the line in the shoulder as well. So we have decreased stability in the shoulder. Okay. So to sum up those 3 realms of injury risk reduction, we will always want to be conscious of our form while training, and we want to be flexible enough to modify our programming based on how we're feeling. Does that make sense? Okay. So let's say we have an injury. When can we train through it, and how do we train through it? So a lot of times people shy away from injury or training when they have an injury, and they say, I'm just going to take off like 4 weeks and see how I do. Well, you're going to lose a lot of strength during that time, okay? And moving actually helps you feel better. So we might not want to necessarily stop training altogether. So what do we do when we have an injury? We go into the gym and we start warming up. If we're warming up and things start to feel better, great, keep moving. If things start to feel worse, stop and shut it down, okay? When we walk into the gym, we want to get a baseline level of pain. Where is our pain for that day? When we start our warm-up set, where is our pain when we start our warm-up set? And we use a scale from 0 to 10, 0 being no pain, completely normal, and 10 being, again, we talked about shark biting off your head, right? So if you walk into the gym and you do your first set and it feels like a 3, but it's really not that bad and you can tolerate the 3, and you keep warming up and it stays at a 3, fine, train. If it starts to increase to a 4, 5, 6, shut it down. So if things stay the same or get better, train. If things get worse, shut it down. If you have sharp shooting or diffuse pain, not today, okay? How many of you foam roll, mobilize, get soft tissue massages very frequently, like on a regular basis? Not that many. Are you lying? Don't be. Okay, so, well, there's this like big thing about mobility and like making sure that you attend to your tissue and blah, 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 blah. But does mobility work and soft tissue work really cure the issue? No, it makes us feel better. If you get a soft tissue massage or if you do your mobility work and you feel better, but you never address the fact that your wrists are overextended, you're always gonna have that elbow tendonitis. You're always gonna have that shoulder pain. So we need to address the issue, which will help fix the tissue down the line, okay? All right, now this is my favorite, well, it's all my favorite topic, but this is a really big topic for me right now because I've been very passionate about helping women who experience stress incontinence while they're lifting. So incontinence is the involuntary leakage of urine at a time that you don't want it to happen when you're not in the bathroom. And the type we're mostly concerned with in powerlifting is stress incontinence. So that's when there's a physical stress to the body or inside the body, internal stress that causes a leak to happen. Typically in the general population, stress urinary incontinence is associated with coughing, sneezing, running, jumping, yelling, crying, and it affects a large portion, the numbers are a little weird. I'll go into that in the next slide. But it affects women as they get older, okay? General risk factors for stress incontinence are age, body habitus, so being heavier, and number of pregnancies, okay? However, we are seeing stress incontinence in the young female powerlifter between the ages of 18 and 35 without pregnancies, so without children. Why is that happening? So just to go into some numbers, in the general population, stress urinary incontinence, depending on the study that you look at, is somewhere between 5 and 30%. That's the general population. Currently, my husband and I, who's a professor at Adelphi University, we're conducting an institutional review board approved study on stress urinary incontinence. And it's a survey study just to get general trends in the female population of powerlifting. We've had 51 respondents, and the incidence rate is 74.5%. Okay, that's so much higher than the general population. In addition, the inclusion criteria for this study were females between the ages of 18 and 35, so they don't have a hormonal risk for stress incontinence. They've had no pregnancies, so that's another risk factor that they don't have. And they don't have any medical disorder that affects urination. And the incidence is still much higher than the general population. In our study, 100% of the 74.5% tested negative on the pelvic floor impact questionnaire. So anyone who has been diagnosed with stress incontinence tests positive on this outcome measure. And all these women have not tested positive. So this is a different diagnosis and something different that's going on in the general population. So what are reasons that this has happened? Well, and so first I'm going to get into why I got into studying this. And it's because I experienced one time stress urinary incontinence on the platform. And I actually think it was at my first USAPL competition. And right after that happened, Becca was like, let's go do a drug test. And I was like, sorry, just peed it all out. And I actually, what happened to me was I lifted a load that I wasn't prepared for, and I had movement breakdown. And as the load was, first of all, too heavy, and when my movement broke down, that's when I had the leak. So I was like, I'm never letting this happen again. But I became very, very fearful of it happening. So I started going to the bathroom before every work set in the gym. And one of my training partners was like, Rori, you have a problem. Stop. You go to the bathroom like 15 times while we're training. There's something wrong with you. So I had an experience that led to fear, that led to a behavior. And then what's happening is when you're training on an empty bladder, it changes the muscle physiology. So it changes your strength of your pelvic floor because you're always training on an empty bladder. So God forbid one day you have a more full bladder. Your muscles aren't strong enough to contain. So then you have an accident. So it's a fear, an irrational fear, or perhaps a rational fear that leads to a behavior that leads to a physiological change. So we're seeing this happen in the female population. And I've done like multiple consults with them, and I've helped them. And what we do first to identify So let me just go on to the next one. So first we want to identify what's happening. So I have people journal. I take a full history. I say, when did this start happening? Where in the lift is it happening? Journal your water intake. Journal your bathroom intake, your bathroom breaks when you're training. So we have to identify what's going on. It's going to be different for everyone. And then we're going to also assess programming and technique. So I'll look a lot of times, and this is just observational. We haven't run the numbers in the study yet, but my observation is that people who train with percent-based training have a little bit more of a problem than females who use RPE-based training. Why would that be? Does anybody have any clue why that might be?
Because of the lack of fatigue management, and that, they're going more intense.
Exactly. So that's my theory, and we're going to be looking at the numbers in the study. So we assess the programming, we assess technique, we look at where it's happening in the, for someone who's experiencing a leak at the bottom of the squat versus someone who's experiencing a leak when they take a breath in before the squat versus someone who's experiencing a leak on the way up, your approach might be different in managing it. So it's a really unique, I almost want to call it a diagnosis. It's very unique, and not everybody is the same, and I have approached every female that I've worked with. I approach the diagnostic and assessment the same, but the treatment is usually different for every female. At the same time, it might not be just technical technique and programming and fear avoidance thing. There might be something that's going on, and at some point, if I feel that it's not anything that I can help them with, I'll recommend that they see the appropriate practitioner. So either their urologist, gynecologist, or a female physical therapist who studies women's health. Okay, which brings me to finding the right clinician for you. So you want to always work, if you have an injury or something that needs medical attention, you want to work with a licensed professional. So that is not the personal trainer who takes 10 weekend certifications and thinks that they're a physical therapist. You want to go see a licensed professional. So they're licensed by a state board, okay? They have a license to practice their profession in your state. So an orthopedic doctor, physical therapist, chiropractor, massage therapist are all licensed professionals. So these are people who have had extensive schooling, extensive education, and then passed a state licensing exam. And how do we find this person to help us? Well, I talked earlier about the Clinical Athlete Network. So you can go on the Clinical Athlete Network. The founder of Clinical Athlete actually interviews every single clinician who's on there. He doesn't put them on there if they haven't gone through the interview process. And there's a map. You can put in your zip code. You can read the bio on all of the professionals that you want to work with. Ask your friends, your lifting buddies, who have they worked with? Who are they happy? So who are they happy who has helped? Who are they happy with who has helped them? So referrals, hey Joe, who did you see for your knee pain? And that because they're still lifting and they had knee pain, the doctor didn't tell them to stop, right? And then do your research. So a lot of the people who come to see me, they've already read about me. They know who I am. They know my credentials. People know more about me than I do when they come to see me. I'm like, oh, I forgot about that. So do your research, read background information on the clinician, check their certifications, and read reviews. So that's how my recommendation in terms of finding a clinician that can help you, who just doesn't say, take 4 weeks off or never squat again. And that's it. Any questions? Oh, hold on.
When you program somebody who's been injured, do you change the RPE levels or do anything or just use pain to manage what you would normally do anyway?
The general answer is it depends. And I think that we've all said that this weekend. It really depends. How long has the injury been how long is it acute? Is it chronic? Do they really need time off? Do we just need to take the RPE down, or do we need to start from square one? So it really honestly just depends. It depends. RPE 7, Jim talked about RPE 7 yesterday. That's a really good number. and also taking into account pain levels. So like I said before, that +2 on the pain scale. So we want to get that baseline level of pain and not let it increase. But also when we're dealing with injuries, we don't want to let form break down either. So even though their pain level might not be increasing, if we see that their form breaks down, then we want to back off a little bit. So I've had to help people kind of like reformulate their internal RPE system, because they're like, oh, that's a 7, but on all their 7s are like knees falling in on every set. So then that's not a 7 anymore, because that's too hard for you to maintain your knees out. So we want to use the limiting factor. So that would be hip weakness or the knees out. Hello.
In your clinical practice.
Hold on, turn on the mic.
Oh, it's on.
It's on standby.
In your own clinical practice, how have you found that like coaching style, psychology, and like educating a patient on pain has helped alleviate their pain and not just going by like technical numbers and things?
Oh, that's huge. The way that you talk about pain is really important, both as a clinician and as a patient. So a lot of times people have been experiencing an injury or pain for so long that they're very fearful. So for instance, I have a client who had a pec tear and repair, and his bench progress is so slow because he's very fearful of his pec re-tearing. Even though they bound that down, it's not tearing, and he's not using very heavy loads. But every week I get like an email like, oh, it hurt. I felt a tweak. I think I re-tore it. And then one day he came in and he's like, do you think that I'm just like scared shitless? And I'm like, yeah. And just having that conversation about like stop being scared really helped him, and we've seen a lot of progress since. But I also think that for me, I have to let it kind of happen organically on the client end. Like I can't just walk up to someone and say, stop being a little bitch, because not everybody can handle that, and so part of being a physical therapist is recognizing the personality. Well, here we go again with personality, is like recognizing what the communication style is and how the person's personality interacts with yours, and how you can approach it will develop as your relationship develops. So I wouldn't just be like day one, like stop being a bitch. Like we've been working together for like, I would say 12, 16 weeks. And I was comfortable at that point when he brought it up to be like, yeah, you're like a little scared. So.
So Sonia, we talked yesterday and today about intensity and how that can increase risk of injury. Can you talk a little bit about volume and frequency, which are other variables that affect programming?
Absolutely. So with volume, we get increased fatigue over time. So just because every set is in an RPE 9, our muscles are becoming fatigued. So we might say that all sets across were like a 7 or 8 RPE because the load was light, the percentage of our estimated 1RM was very light, and like, yeah, that should be easy and manageable, but we get tired. So we might say that our beginning sets in the beginning of the workout were very technically sound, but then towards the end, we start to see our knees cave, our back round, we can't hold our back, our grip is starting to fail us. So we need to take into account that there's fatigue developing, and then in that fatigue range is when we start to see injuries kind of develop. And then also frequency. So perhaps someone can't manage 3 days of squatting every week, or that 5-day bench program is too much for them to handle. Back off a little bit. Maybe that 3rd day or that middle day is a really light day just for blood flow. So.
Okay, thanks, Rori.
Reactive Training Systems. Reactive training systems.
All right, guys, we're going to go ahead and get started. So I'm not sure if we have anybody left in the bathrooms or not, but we'll go ahead and get started and they can join us. So this is kind of the last of our prepared presentations, but it's one that I'm also really excited to talk to you guys about. Planning and programming is something that I'm really interested in. That's a kind of what I like to tinker with probably the most. So what I want to talk to you about today are some kind of deep underlying problems with traditional planning methods, and what I've done and what I've learned as far as working around those problems, and how it's kind of led to some unique solutions, and frankly how it's led to a lot better results for our athletes. And so we're going to just kind of jump into this thing. First off, this may come as a surprise to some, but periodization has problems. It's not a perfect solution to our training and planning needs. So what I'm referring to here are the more established periodization models. So think of things like block periodization and undulating periodization and linear periodization and all the other, I guess, smorgasbord of vocabulary words that you've learned to describe different ways of doing the training planning. There's some issues with it in terms of there's really just kind of a lack of long-term clarity. And we'll talk about annual multi-year planning, but it's this vague amorphous thing, that we acknowledge exists, but we have difficulty wrestling with and things like that. And then there are some clear deficiencies within each specific training model itself. We can talk about what some of those deficiencies are specifically, but it really varies depending on which one you're talking about, and I think you kind of need to deep dive into each periodization model to explore those. But suffice to say that there are deficiencies. None of them are perfect. But the thing that we kind of come back to is like it's all supported by science, right? Like we've done the studies. We know that this method is superior than this other method. Well, maybe not as much as you think. So if you look at the periodization science, you'll notice some very clear problems. Okay. First off, a lot of the studies on different periodization models are done with comparison protocols. So you have a group of 18 rugby players, and they have a training status, right? Because we don't like studies that are done on untrained people. They have a training status and they have a training history. And then we're going to take half of them and put them on this other periodization model that we've come up, and we're really kind of thinking in the back of our mind that that's the superior model. So we've got half of them that are still doing what they've always done, and the other half are doing this new thing. And then the half that are doing the new thing get better results. Well, did we prove that this program has better results, or did we just prove that, hey, it's a novel training stimulus? So we measured this thing. Does it measure what we really think it measures? And of course there are ways around that, but those ways don't get tackled as often as you would hope. Also, most of the studies done on periodization are short term. So just to kind of see what you guys think, I guess. What would be an example of a training study that would be long-term? What's a long-term training study?
Actually, I just have a question. What do you mean by periodization? Can you give us that?
Sure. So I'm talking about the way that you go about planning training. So the basic model that you use for planning training. So you start with high volume and low intensity, and then as you progress toward the meet, the intensity goes up and the volume goes down. That's a classic linear periodization model. And there's a ton of different ways to go about doing it. So what would be an example of like a long-term training study? Something that's fairly long-term. Yeah.
I would say like 6 months or more.
Well, that would be nice, but I don't think I don't know of any training studies that have.
What
have been done for 6 months or more.
Are you asking what they consider like their term?
Yeah, like what would be an example? Like you read a study and you say, man, that's a long training period. Maybe 12 weeks, something like that, you know? So it doesn't matter specifically, but the point is that even if you look at a study, and even if there was a study that was 6 months, like that's not long term in terms of like an athlete's career, you know? So there's a short-term bias, and the longer the study gets, the more difficult it gets to control, the more difficult it gets to recruit participants, and it just gets a lot harder, you know? So a lot of studies are biased toward a shorter time frame, and it makes sense, and it's for good reasons, but when it comes to extrapolating what's going to be best for us as athletes over the long term, that's got some pretty significant limitations. Also, it's all group-based. Now, I talked about this yesterday when I was talking about the personality interventions. That was also group-based. We're looking at population averages and deviations from those averages. You know, that's kind of how it's got to be done a bit, but it's sometimes useful, but for answers for you as an individual, that's not prescriptive. You know, you can't say, because this is the average, therefore I need to do it this way as well. Because raise your hand if you're exactly average. Right, nobody, right? So the average problem it's a problem, right? And there are big variations around the mean. So yesterday we found that, let's see, so among the higher level lifters that we talked about, the average conscientiousness was in the 65th percentile. But the range for each individual went from 1 to 99. Okay, so there's a huge range, and that's going to be important for that individual. Lots of studies are done on untrained subjects, which also poses a problem. But even if they're not done on untrained subjects, what is considered to be a trained subject is not very well trained, you know? So that's a problem as well. Then there are the more generic science problems, lack of replication, lack of negative publications, and so on and so on. And the biggest problem is over-concluding. So I have a quote up here that I want to read to you. Does anyone know who John Kiley is? You know, a bit. He's written a bit about periodization and some critiques of periodization that I think are really, really insightful. So I have a quote here from an article that he wrote about periodization science, and it says, in a sense, trying to piece together a comprehensive periodized philosophy using available evidence is like looking through a keyhole and trying to describe the outside world. We get imperfect and incomplete, potentially misleading snapshots, but since these are all we have, the overriding temptation is to construct a grand, all-encompassing philosophy around woefully incomplete information. And now I want to talk about, speed up a little bit here, but I want to talk about the logical roots of periodization. So periodization as we know it now, and the current training models and stuff that we have now, the way that we plan training, has its roots in the Soviet Union. And it came about there because as they're imposing these top-down political structures, they apply a top-down planning system to farming. They apply a top-down planning system to every aspect of society. And sport training was no different. So since there is this top-down planning paradigm that gets applied to sports, and since they were good at sports, the assumption is that that's the best way to do it. So the issue is that you're dealing with a human being. And a human being is a complex system. And what I mean by that is that you give an input. And you give input A, you get output B. Okay? But with a human, you get a complex system. So this time, I give you input A, I tell you to squat 3 sets, and you get output B, your squat goes up. The next time I tell you to squat 3 sets, and you get a different output. Maybe your squat doesn't go up. Or maybe it goes down. Or maybe you get some other sort of effect. So you get these nonlinear effects, and to try to shoehorn a complex system into a top-down planning model things get jammed up and things don't work quite as well as they ought to. And that's fine if you're running a national team and you can just take in 1,000 athletes and grind them through your system, and you can spit out a handful of champions that fit that system just perfectly. But that's not any of our situation. You have one athlete and you're trying to get the best results possible. Your body's not a washing machine. Who's heard the statement, food is fuel? Okay, food's not fuel. That's part of what it is, but it's also a social experience. It's also many other things. And if you treat it as only one thing, you're kind of treating your body like a washing machine. And you're a lot more complicated than that. You get these nonlinear effects that we were talking about. And if you only treat it as fuel, you get weird outputs. Okay, so that's why it's important to at least consider more of the complexity of what you're dealing with. Then there's the whole issue with debating optimal periodization methods and stuff like that. Block periodization being superior to linear periodization and blah, 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 blah. And I've participated in a lot of that before, right? But there's a problem that comes about with it. A lot of these are much more similar than different. So I mentioned block periodization and linear periodization. These are two different schools of thought, and they have like strong adherence on both sides of this, right? Block periodization is superior to linear periodization because Isherin says so, and all this stuff. But if you look at what you get when you do the planning, they're very similar. But I mean, you try to tell that to one of the advocates of any of these planning models, and they get pretty irritated by that. And a lot of the animosity between these different groups comes from interpersonal conflict because the founder of this school didn't like the founder of that school and stuff like that. And then there's the question that I talked about earlier when we were talking about the problems of are we measuring what we think we measure? There's the issue that maybe it's a change in the stimulus itself that's causing the adaptation. So I always have to caveat stuff like this with what I'm not saying. I'm not saying science is bad. I'm not saying periodization is bad. I'm saying our assumptions are bad. I'm saying let's at least consider those, at least reconsider those, and see if maybe we could be doing things a bit differently, or maybe we should be doing things a bit better. So let's think those through. So if we kind of start with that framework in mind, where do we go from here? I don't think the issue is with how training's organized, but it's more about how you manage it. Everybody knows that the plan's going to break. You start off with a training plan, and you know that that's not what you're going to stick to. And we talk about RPE training, we talk about these different tools that are more flexible. We know that the plan is going to break, so it's not so much if, but when, and then what are you going to do about it? The plan has to adapt to emerging information. As you learn more about yourself, as you learn more about how you're responding to different training stimulus, you've got to adapt and change and move. And what I'm going to talk about next, the emerging strategies, is a framework for how to think about that. It's a framework for how to deal with this emerging information and how to be more agile, basically. But you may ask, can't we still use these periodization concepts that I so love and focus on the emerging information at the same time? Well, maybe you can, but that's doubtful. And the reason is because in a lot of cases, systems drive behavior. And if you're in a system that doesn't reward you for paying attention to emerging information, if you're in a system that doesn't encourage you to think like that, then you're not going to think like that, or you'll be less likely to think like that. Now, we talked yesterday, I think during the Q&A, about how if you have a plan and you've planned for 12, 16 weeks, and then you're 4 weeks in and something goes wrong or something's off track, you're reluctant to change it, because, well, you have this plan and, you spent time and effort to make this plan, so you ought to stick with that, Well, that's a cognitive bias. That's a tendency to do something that's not ideal for you. And that's what I'm talking about as far as like systems driving behavior. So I've got another John Kiley quote here for you. And it says, but crucially, when we look back on what's been written about periodization, and especially when we look at the most widely read publications and theorists, it's the plan that's promoted, it's the plan that's debated, it's the plan that's persistently highlighted. Whereas the process, the need for the coach to be tuned in and alert, the need for the coach to be a creative problem solver, the need for the coach to be responsive to emerging challenges, and the need for the coach to nurture athlete education, and the need for the coach to be sensitive to weak signals heralding growing risks and vulnerabilities is persistently undervalued. So how do you solve these problems? And as I was thinking about this, like, okay, so we've got these problems and these sorts of issues, so what do I do about it? Well, I kind of had a thought, like, how would I train if I'd never heard of periodization? What would I do then? Well, if you never heard of any of this, if you don't know that, well, next week is supposed to be a little bit higher intensity than this week, and so on and on. If you never knew that, what would you do? Well, I thought back to how I trained in the very beginning when I didn't know any of that. And I thought, well, I just kind of went to the gym and I did a thing, and if it worked, it kind of kept doing it. And then when it stopped working, I started doing something different. You know, okay, maybe that's not so bad. Like, let's play with that idea a little bit more, okay? Basically, we're talking about having this complex system, and instead of answering that complex system with more complexity and these complex models and interlocking cycles and all this stuff, what if we simplify it? What if we answer complexity with simplicity instead of more complexity? So let's remove, how do we do that? Okay, let's remove as many variables as we can and simplify the training process. We'll be able to more accurately assess what works and what doesn't, and instead of using a top-down planning process, we'll use a bottom-up planning process. Whoa, what does that look like? And that's where I got stuck for a long time. When I finally talked to some smart people, does anyone know Dr. Anatoly Bondarchuk? Too? He's probably the most maybe the most successful coach ever, but definitely the most successful throws coach in terms of number of Olympic gold medals. And he was a gold medalist himself. Anyway, in the early 2000s, he came to Canada and was coaching up there. And so he's written a lot, and his writing is tough to decipher. But he worked with some Canadian coaches, and they learned his system and got to see, like, learn by doing, see what he actually does, you know. And so I've talked to, one of those coaches is Derek Evely, and he helped me piece a lot of this stuff together. And also Martin Bissinger, who trained under Bondarchuk. And so a lot of these ideas start with Bondarchuk's ideas on how to train throwers. And that's a bottom-up system. And that's, when I heard about it, I was like, light bulb, that's how you would do it. That's a bottom-up system. If you were gonna figure out how to implement this in a powerlifting setting, you would basically do something that looks kind of like that. Okay, so what does that look like? It's what I'm calling the emerging strategy, because like I said, it's a bottom-up system. You're allowing the long-term plan to emerge from the short-term plan. We're going to take that short-term plan, we're going to do what works, and we're going to keep doing it for as long as it's working. And when it stops working, we're going to do something else. And we're going to learn about you and how you adapt and how you respond to the training stimulus. We're going to figure this stuff out as we go, and we're going to get better as we go, okay? So the framework for a bottom-up approach is we're going to remove as many assumptions as we can. And we're going to use systems to monitor your training. So think of really, so that all these web tools that we've been developing have been in large part a response to this, okay? So things like the training log have been specially designed to fit into this framework because we use it as coaches. Things like Track that we use to monitor training and recovery have been designed to help us answer these questions, okay? We want to monitor the athlete. How are they adapting to the training? How are they recovering from the training? Things like that. And then we're going to use contingency planning to have a plan in place to deal with emerging information. What happens if we're 2 weeks out and all of a sudden it looks like the athlete's peaking too early? Well, let's have a contingency plan for this stuff. We don't have to set it all out in advance, because if we have this long-term plan and things don't go according to it, then there's that tendency to hold on to the plan for too long. So we don't need that long-term plan so much as we need contingencies and adaptability and flexibility to respond to these changes in this emerging information. Okay, what happens if we have a non-response to a cycle or something like that? And then we get fairly uninterested in long-term planning, at least until you know the athlete quite well. Because what we have to do first is improve the short term. First, we're going to improve this cycle, then we're going to focus on the little bit longer time frame. And then if we get really good at putting together successful training cycles, then we'll try to put together 2 training cycles. And then we'll try to put together 3 training cycles. And if we can do that, then we're getting a pretty good long-term plan established anyway. So we let those things emerge from the short term. So I want to compare and contrast just real quickly here the top-down, the bottom-up approach. The top-down approach uses prediction models, it plans training far in advance. There's not much emphasis on contingency situations because, hey, we have a plan, right? It requires minimal monitoring, and there's infinite variations, but there's a finite number of different planning models. So it simplifies our decision-making a bit because there's this model to follow. The bottom-up approach makes minimal predictions. It keeps planning durations very short. It has a heavy emphasis on emerging information. It requires extensive monitoring, and it requires an emphasis on small cycles, so the variations are infinite, and in some cases that can be a little bit overwhelming. So we talked about problems of periodization. How does this bottom-up approach solve those problems? Basically, it doesn't apply heavy emphasis on periodization science because that's not really part of the system. It ignores Soviet planning constructions. It implements a process-focused approach instead of a planning-focused approach. And there's contingencies in place to deal with those emerging information situations. But all tools have weaknesses, right? So I'm kind of starting to lay out a framework here, but up front, I want to be honest with you and say, this isn't perfect, okay? So there's definitely some weaknesses to going this way. And some of those weaknesses are it requires extensive monitoring and coaching attention. If you are a coach and you can't pay attention to your athletes that much, if you can't develop a relationship with your athletes, this is not the way to go, okay? It also requires good record keeping. If you're an athlete and you don't log your training, this is not the way to go. Don't do it. All the variations, all the possibilities can be a bit overwhelming, because what are we going to do in the next block? Well, you could do just about anything, you know, and at least until you start to get an idea of what the athlete responds to, and that's a lot of possibility. So that can be a bit overwhelming unless you have a pretty good idea of what it is that you're trying to accomplish. And then there's an emphasis on coaching knowledge. Since you have basically all the tools at your disposal, and you can use any of them, you have to be knowledgeable enough to know which tool to use. So I want to review what we talked about so far before I get into the next part. We talked about problems with periodization, and I'm going to have some questions, so whoever's got the mic. We talked about problems with periodization and how to solve those problems, strengths and weaknesses of the bottom-up approach. What I'm not saying, that we're going to try to focus on the method. We also talked about defining what the emerging strategy is, and the top-down versus bottom-up. So some questions for you guys real quick. What's your reaction to this? I mean, I think some people are maybe confused. Probably a lot of people are confused, but because I haven't really said much so far except for criticizing periodization. But do you have any sort of emotional reaction to this? Yeah.
I think it makes sense, and I think it's like intuitive with working with an individual athlete, but it also leaves a lot of questions of like, even when you peel back all the layers, what is the base plan that you're starting with? Like, I guess that's the big question mark for me, is like, there has to be some bottom of the pyramid.
Sure. So one thing that happens, so I'm talking about this top-down approach, right? So we have this top-down approach, and we see that, hey, that doesn't work quite so well because I can't predict where you'll be 12 weeks from now. So we start planning shorter and shorter training cycles until we're like, well, you should never plan more than 3 or 4 weeks in advance anyway. Well, maybe, but maybe not, you know? So we still have this top-down approach, but it's got these little feedback loops, you know? What I'm talking about is kind of turning that on its head. So it's a bottom-up approach, but little feed-forward loops. You know, so instead of we kind of know vaguely where we want to go. Like I can tell, hey, there's a competition that's 4 months from now, and I know that that's where we're going. So we can tweak things as we go, but really we're letting that plan emerge. But yeah, good observation. Hopefully we'll get those questions answered here in a second. Any thoughts that you want to challenge to this? So like I'm kind of slaying some sacred periodization cows. Anything that you want to say, hey, you're wrong about that? Just want to give you the opportunity, if you care to voice those concerns, then that's fine. Yeah. Low agreeableness right here. No, I'm kidding.
This isn't necessarily something that's like going against what you're saying, but I almost see this also as something like similar to periodization in a way. It's just that you haven't planned far in advance. Like the specificity of what you're doing of like for the sport of powerlifting, like rep ranges, volume, intensity, the lifts that you're doing, the variations that you're doing are still very much similar as what any other periodization scheme would do. It's just that how you're planning it in the length of time that you're doing is just going to be based on what's happening in the now instead of what you predict might happen 12 weeks from now.
Yes and no. So we'll get more into maybe I should stop asking questions and start talking, right? But yes and no, but I think we'll get more into like how that's going to play out. But if we define periodization as a way of planning training, then yeah, this is definitely a periodization scheme. It's a different periodization model, but I think it's something that relies a lot more on the emergence of information, and we're not going to over-plan the thing, okay? So let me share a bit more about what I am saying. So we've talked about so far some problems with the top-down planning model, some pros and cons of the bottom-up, and we want to solve problems of complexity with more simplicity. So let's get a bit more practical here. So I say we need to simplify things. How do we want to do that? Like, the first thing would be, don't change the training stimulus. We end up changing the training stimulus all the time. So let's stop doing that. Basically, we start with building a training microcycle. Okay, so that would be a training week. In most cases, it's going to be a training week. And this is going to form the base of your development cycle. Okay, you basically have a week of training. So I have listed here on the screen a week's worth of training. And this is from an actual development cycle that I was doing in October of 2016. You can see it's a week's worth of training. And I did that training week, and the next week I did it again. And the next week, I did it again, and then I did it again. It's the same training week over and over. The only thing that changes, the weights will change a little bit so that I can stick to those RPE objectives. So the weights fluctuate a bit, and hopefully are trending up as I'm getting stronger. But it's the same reps, it's the same intensities, it's the same exercises, it's the same structure of the training week. Everything is pretty much the same, okay? Now, what I'm doing during that time is monitoring my training results, okay? So you're repeating the training week, you're monitoring your training results. Now results are gonna improve, but they're only gonna improve up to a point, right? So just because you improved last week doesn't mean that you're absolutely gonna improve this week, although you could. So that's gonna improve up to a point, and then you won't improve any further. Now that point is your peak condition, okay? Now, achieving a real peak condition is important, and we'll talk about that a little bit more in a minute, but achieving a real peak is important. And we're gonna measure how long it takes you to go from the start of the training cycle into that peak condition. And that's known as your time to peak. Now, your time to peak is gonna be fairly stable unless you start changing a lot of really crazy stuff between development cycles. But if your development cycles are of similar training strategy, then your time to peak is going to be fairly stable. So I know that for me, my time to peak, if I'm doing one microcycle for each week, is about 6 weeks. And I know Rori is 4 weeks. So it varies from person to person, but it's fairly stable, okay? So what you do is in the first training block that you're doing, you don't know what your time to peak is. So you have to take it a bit too far, all right? So you can see in these graphs here, so we've got a squat, a bench press, and a deadlift. These are estimated 1 RMs from the training session. And we can see that results improve and results improve, but then at some point they stop improving. And it's pretty obvious to look at this and see where those peak conditions happen. So then you see how long did it take. So it turns out each of these data points is 1 week because it's 1 microcycle per week, so you just count them up. 1, 2, 3, 4, 5, 6. 6 weeks. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5. So 5 weeks on the squat, 6 for the bench and the deadlift. It's one of the weird things that just kind of happened, and I can't really explain to you why. It's pretty much similar across all your lifts. Okay, there may be some slight variations. You know, one lift might peak a week earlier or a week later than the others, but you can treat them as roughly the same. Okay, so for a person like this, we would probably peak them in 5 weeks, maybe 6 weeks, depending on how things were progressing overall. Now, there are some different patterns that you're going to see as you do this. Okay, there's type 1, 2, and 3. So type 1, which you see here on the left side, they basically just improve. It's good to be these people. You put them on a development cycle and they just kind of get better until they hit that peak condition. You know, each week is a little bit better, a little bit better. And this is a really nice pattern. You see that there's a big jump and a small jump, a big jump and a small jump, a big jump, and then that's a peak. So if you know that about the person, that's really useful information. Now, a type 2, here we're looking between these yellow dots, okay? The yellow dot on the left is, or the yellow highlighted dot rather, on the left is the start of the development cycle, and the one on the right is the end of the development cycle. So you can see that at the start, there was a dip in performance, and then a consistent improvement all the way up to the peak condition. So that's type 2. And then type 3 is the one on the bottom here, and there's a stagnant response through most of the training block, and then a jump at the end, okay? So those are the 3 basic response types. Most people are going to fall into those categories. I would say most people are type 1 or type 2. Occasionally you'll get a type 3. It depends a little bit on what type of training cycle that you're doing, but again, this is somewhat specific to the individual who's doing the training. Now, just a real quick aside, it's kind of hard to detect a type 3, and that can lead you to some issues, right? So what we have here is a graph that runs out to 11 weeks, or 11 microcycles, and we can see that peak condition happens on the 11th week, or rather the 10th week, sorry. So the 10th microcycle is where we have the peak condition, okay? Now, think back to the beginning in week 1. You don't know that the whole right side of this graph exists yet, okay? So as you're going through it, you know, week 2 is an improvement, week 3 is a down, week 4 is an improvement, week 5 is an improvement, week 6 is a down. So in week 6, you might be looking at that and thinking, oh, well, their peak condition is in week 5, right? Well, maybe, but let's keep going a little bit and see what happens. Well, they improve and they improve, and it turns out that's what we've been calling a mini peak, but there's this whole other side of the iceberg if we just kind of keep going and exploring. So you've got to go long enough to be certain, or at least reasonably certain, that you're in a peak condition. So when do you end the first development cycle? Well, when you're fairly certain that you've hit that peak condition, or the athlete's feeling like they're an injury risk or something like that, then it's time to stop. So use your brain. Don't hurt your lifters. You know, you wouldn't want to push them until the point of injury. So if they're telling you like, look, this is not a good idea to keep going, then listen. But other than that, you want to make reasonably certain that you've hit that peak condition. So after that, when you do subsequent development cycles in the future, you don't have to go too far, okay? You know, hey, this athlete peaks in 5 weeks, so you can go 5 weeks, maybe 6 weeks if they're feeling good, but you don't have to go too far. You know when they're going to peak. So what do you do after a development cycle? Well, it kind of depends on what the landscape is that you're dealing with. If there's a competition that's coming up real soon, then maybe you go into a maintenance phase. So you're just trying to maintain that peak until you can get to the competition and display your results. Now, if there's no competition nearby, you would go into what we've been calling a pivot block. It's also been called a washout, a restoration, a rest cycle, a cleanse cycle. We've just been calling it a pivot block, okay? You would do that really if there's no contest nearby, okay? So what's a restoration cycle? What's a pivot block? What is that? Well, basically, you've been training the same way. You've been repeating the same microcycle over and over and over until you get to this peak condition. Now you're in a peak condition. Now everything changes. You change, you reduce the fatigue, you lower the intensity, vary the workout structure, reduce the training stress. So it's a deload, but it's more than a deload, okay? You're reducing the training stress and allowing the athlete to recover, but you're also doing things that enhance their adaptability for future training cycles. So you've got to change the exercises. You've got to change the stimulus. You're not trying to wear those things out anymore. You're trying to let them recover and adapt. It's important to take these pivot blocks seriously. So people have a tendency, lifters have a tendency that when we get to the deload that we go, forget it, you know. We make easy training too easy, or we skip it. And it's important not to do that because there is a real training value to doing these pivot blocks. It helps you to adapt. It helps you to respond better to future development cycles. So take it seriously. So I've got another example of what a development cycle might look like. You can tell that the competition lift is still in there, but the intensity is greatly reduced. All the other exercises have changed. They're highly non-specific. There's not a lot of heavy stuff. You're doing deload training, but you're also getting out of your typical movement patterns and doing things to enhance your general athleticism and things like that. So how long is a restoration cycle or pivot block? Well, it varies, and it's kind of difficult to nail down a little bit, but we start with roughly a third of the length of the development cycle. So if your development cycle was 3 weeks or 4 weeks, then we're going to do a 1 week pivot. If your development cycle was 6 weeks, then we'll do a 2 week pivot. If your development cycle was 9 weeks, then we'll do a 3 week pivot. On average, I can tell you this, on average, the development cycles that we see are between 4 and 6 weeks, 5 and 6 usually. Occasionally, well, more than occasionally, oftentimes you'll have lifters who are, 3, 4 weeks. Oftentimes you'll have lifters who are 8 weeks, 9 weeks. I've had someone go 10 weeks of repeating the same workouts over and over and continuing to improve for 11 weeks. Now it gets pretty unwieldy at that point in terms of being able to do agile planning. So there are some things that you can do to manipulate that, which we'll talk about. But roughly you want the pivot cycles to be a third of the length of the development cycle. So if you do your next development cycle and you kind of don't get the response that you were looking for, then it could be that your pivot cycle was too short. So maybe you want to make it a bit longer. If you have a 2 week, say a 2 week long pivot, and you lose all your strength, then maybe you want to look at shortening that pivot or training a bit heavier during the pivot or something. So the idea is to maintain your strength on as low intensity as you can get away with, and with as little volume and specificity as you can get away with as well. So just quickly before I get into the last section, I want to review what I talked about so far. We talked about designing a microcycle, designing one training week and repeating it over and over until you hit a peak condition. And that's your development cycle. And then we talked about following that peak up with a restoration cycle or a pivot block. And we talked about the response types and measuring the time to peak. Okay? So again, that time to peak is fairly stable unless there's a drastic change to the overall training stress of the cycle, or more commonly, unless you change the frequency of the training cycle. okay? So far I've been talking about doing 1 microcycle in a given week, okay? It's 1 week of training that you repeat the same week over and over. Well, it doesn't have to be a week. You could basically have A-B workouts, and then you would get through 2, if you did 4 workouts a week, you would get through 2 microcycles in a given week. And that's the example that I have here. You'll look at Monday, and that's exactly the same workout that you do on Thursday. Tuesday's workout is exactly the same workout that you do on Friday. So it's A, B, A, B. Okay? You're getting through 2 microcycles in 1 week of time. Okay? Now, what does that do? Well, your time to peak is not so much about time, it's about exposures, roughly. Okay? So if your actual time to peak on a 1x frequency was 6 weeks, and then you double that frequency, you would expect theoretically that it would take you about half the time. It's still 6 exposures, but about half the time. Now, in reality, we see that that's not quite the way it works out. You know, real life is never as nice as a math problem, it seems. So in reality, the way it works out is your real peak will be typically more around the 4-week mark or something like that. So it's definitely shorter. So those people I was telling you about who it takes them 11 weeks to peak, and we said that's kind of unwieldy and not very nice to deal with, well, you can double the frequency and have them do a 2x microcycle frequency, and it'll take them roughly 6-7 weeks to peak, which is much more manageable. I just want to reiterate that training in this peak condition is a rare and valuable thing. So you're training, you're repeating the same workout week after week, and you're getting better and better and better and better. And when you get to that peak condition, training there it only happens a couple times a year, okay? So if you take 6 weeks to peak, which we said is average, and then you do a 2-week pivot block, and that's all you do, and you never take a vacation, and you never have any competitions, or you never have anything that throws off your timing, it still takes you 2 months to get through a cycle. So only 6 times a year are you training at the pinnacle of your ability. Now, think about what adds to the pinnacle of your ability. Like, you have to get as strong as you've ever been to get a little bit stronger, okay? You don't go from, you know, being a 0 to setting a PR in a couple weeks. Like, that's a process, right? So you've got to get into that peak condition to get to the next level, okay? So it's important that you actually be able to get there. So that poses a problem for people like me who peak in 6 weeks. If I do a training program that runs 3-week training blocks, well, I never really get into that peak condition, do I? You know, I'm deloading, feels like, all the time. And that's true because it's not tailored to my individual response. If you train with a low frequency, so 1 microcycle per week, you get fewer peaks per year, but each peak is a bit bigger. If you train with a higher frequency, you get more peaks per year, but each peak is a bit smaller. So the real question is, which one leads to the best long-term progress? And I don't know. It's probably an individual response. So, peaking for competition. If you have a competition that's coming up and you're trying to decide when to peak, this makes it a lot easier. Okay, you know this about yourself. You know that you peak in 4 weeks. So you know that you need to start your last development cycle so that that peak workout happens on the competition day. Okay, and now from there you can basically train normally up to that point because you know that it's the 4th competition workout and that it's always the 4th workout. And if I put that 4th workout on the competition day, then I'll perform at my best. You know that about yourself. Okay, so you can just kind of work backwards from there and start and peak and deload and all those things as you need to peak on the competition day because it's tailored to you. So what you'll do is train normally up to the competition. You rest for 2 or 3 days prior, and there's very little taper, there's very little deloading that needs to happen as you go into the meet because anything like that is going to be a deviation from what's normal to you. You know how you respond to training, and you know that you go in this direction, so you don't want to deviate from that if possible. So you can train up to the competition date, rest 2 or 3 days prior, and if nothing else, that's a really good starting point to performing your best on competition day. And there's individual variation that can happen after that. Some people do well with a taper, other people not so much, but this at least provides predictably high performance. So again, the strengths and weaknesses of this as a planning tool. It requires a coach who's knowledgeable and a creative problem solver. You've got to be that or else this doesn't work so well for you. It requires excellent communication between the lifter and the coach. If that's not present, we don't use this method. It requires discipline in the peak. When you're getting up to those peak conditions, especially pre-contest, and anxiety is a bit higher, the tendency to go, hey, I'm kind of tired, maybe I ought to do a taper, maybe I ought to do a deload. No, you shouldn't, because we know that you always peak in 4 workouts, and we're just going to keep doing that because it's predictable. I've had a lifter who would improve for 2 workouts and then regress, and it was reliable. 2 workouts up, 1 down, 2 up, 1 down. Now think about that pattern as you go into the competition. You want the competition to be on the up workout, right? So that means 2 weeks out from the competition, you have a bad workout. Okay? So think about how you feel when you're 2 weeks out from a meet and you're going, just anyway, you're just nervous anyway. And then you have a bad workout and they go, oh no, this is not working, you know? Well, I can show them this chart and say, hey, you always do this. This is normal for you. 2 up, 1 down, 2 up, 1 down. You're gonna be fine. And they can see it and say, oh yeah, I do always do that. And then predictably on the competition day, bang, peak performance. So having discipline in the peak is important, and that's the thing that helps this whole system to work. It's easy to see what works. We do a thing we call block reviews. So we get lifters to log their workouts, and then we run a block review on every training block that they do. So when they're training for a big competition, say they're going to nationals or something like that, we start pulling all their block reviews, and we can see, hey, what are the good training blocks that we've done? Here are the successful ones. What do they have in common? And for example, like for me, I know that I've been getting a lot out of things like pin press. I've been getting a lot out of things like incline bench. Pause benching, not so much, but that's me. You know, Ross is in a different situation. Rory's in a different situation. Everybody's a little bit different in the things that they respond well to. What intensity zones do you respond well to? Do you like high frequency training or low frequency training? Well, it's a lot easier to see like this because we've simplified everything enough that we can start to see those patterns. We're getting rid of a lot of the noise and we can see more of the signal. And it's designed to capitalize on emerging information. It dies with no information. If I've got an athlete who doesn't keep a training log, then I'm just guessing. But the truth of the matter is you're just guessing anyway. It's just that other periodization models help you feel better about that guess. So there's that. So I want to talk real quickly about a case study. So what did this look like as we implemented it? So I use Liz Craven. She's a favorite case study of mine pretty much all the time, so we're going to talk about her. She was actually the first person that I used this method on. And so she was a world record holder at the time and a world level competitor at the time even. And so I'm going to try this thing that I've never done before on somebody like that. But we talked about it and that was what we decided to do. The thing is, like when you think about it, it shouldn't be that big of a deal, right? Like, hey, we're going to give you this thing and we're going to see how you do with it. And we're just going to keep doing it for as long as it works. But when it stops working, we're going to do something different. Okay, I mean, that doesn't sound too crazy, right? When you put it like that. So what we ended up doing with her, it's a bit hard to read for you guys here, I think, but it's a 2x microcycle frequency. So it's the A-B-A-B setup. We gave this program to her, and she's a type 1 responder, and her squat just got better, and her bench got better, her deadlift got better. So here around the, well, I think this is 6 weeks to peak. I think this was 6 weeks to peak, if I'm remembering correctly. And I think around week 4, so all these A workouts require a single at an 8 RPE. Now, think about single at an 8 RPE as being a little bit heavier than your opener, right? So around week 4, she's handling weights for single at an 8 RPE in training that were world records at the time. And I started going, oh man. And I'm wondering at that point, should we cut this cycle a bit early? Because you don't want to get someone like that hurt. And I've never done this before, and I don't really know what I'm doing, and I'm just kind of figuring this out as I go. And we talked about it and decided, let's let it ride for a while and see what happens. And it's a good thing we did, because at week 4, it looked like things were slowing down, right? The bench was down a little bit, the deadlift was down a little bit, squat kind of plateaued. We kept going, and bang, there were a big peak if we just went a bit further, okay? So it worked, and it worked really well. And we kept doing that for a year. And actually, this is a picture of Liz and Jess Benedetto, who also did this method. This was the 2016 World Championships, where they both were bronze medalists. And then this year at the World Championships, Liz was a silver medalist. She's set a bunch of open world records and whatnot since then, and has earned her spot as being like the favorite case study of mine, I guess. But she's an excellent lifter and an incredibly hard worker. And her ability to tolerate work and to tolerate volume is like 150% of what a normal person's is. And I mean that literally. We've measured it. So just to review what I talked about so far, we talked about microcycle frequencies, basic peaking strategies, strengths and weaknesses of this method, and we talked about a case study. So some questions for you guys. Do you feel like this as a method is set up more for short-term gains or more for long-term gains? Long-term gains. That's what I thought too, right? And I think in principle it is, but what I've observed from doing it is that the first cycle that I put somebody on is like magic. And that sounds really stupid to say out loud, but I don't know. It's how it seems. Like Mark can attest to that. The first time that he did it, he was like, "What the heck is this about?" You know? And I recently started working with Dennis Cornelius, and in the first development cycle that he did his 900-pound raw squat in his garage, right? Now, I can't claim credit for that because it's not like I'm a programming genius and just I knew the thing that was going to work. That was our first development cycle. Like, I don't have any real great training block reviews to pull for him, and it's not like, oh, I know the thing that he responds best to. But for whatever reason, he responded to that, and it produced a big result for him. So, yeah, I mean, yes, long-term, but we see a lot of short-term progress too, which I guess makes sense if you think about it, because the long-term is built on the short-term. So another question for you guys, what role do you see long-term planning taking as you implement a strategy like this? Like, so what do you do in terms of long-term planning? Any thoughts on that? Yeah.
I'd imagine even though we're all different, we're all not that different, and there's probably like archetypes of certain people who certain things tend to work for, and as you get a history, you would be able to build something that way.
Yeah, I think you're right about that. I think that takes a while to start to figure that out, but yeah, I think you're right. I think as you build up your coaching experience, then there's less trial and error to be done. Yeah. It also leads to some pretty unique solutions. So I've been talking a lot lately about a lifter of mine, Mike Garazzo. Now I've worked with Mike for a lot of years, and he started working with me before this was a thing. And one thing we've noticed is his strength would improve, but it would always fizzle when we get close to a competition. We never kind of had that, that kind of peak that you always want, And we couldn't figure out what was going on with it. But then when we started using this strategy, we figured it out. It's like, It's every time we hit high intensities. It's the high intensities. That's the correlation. So whenever we're on like this middle intensity range, 4, 5, 6 reps even, really 6 reps, he responds great. He gets a lot stronger, But then we get close to competition and we start doing heavy triples and it's just, so let's stop doing that. Like, hey, this thing hurts. It hurts when I do this. We'll stop doing that, right? So we send him into a competition having done nothing heavier than 6 reps at a 9 RPE, which is kind of scary when it comes to attempt selection because you haven't handled the heavier weights. And it's definitely unorthodox, but it resulted in a big improvement and some big PRs for him. Now, one thing that we did going into nationals, instead of doubling the frequency, we halved the frequency. And that stretched things out and gave us more slots to play with. So we could do like heavy work every other week. And that slowed things down enough that he got, I think, 2 exposures to heavier weights. So that was enough that we could make sense of the attempt selection thing, but not so much that it beat him up and tanked his results. And then the bulk of his training was spent on those middle intensity zones where he responds best. I never would have seen that. I never would have figured that out if we hadn't simplified things and slowed it down enough for those patterns to become more obvious. So that's what I've got for this presentation, and I know it went quite a bit long here, but if you guys have any questions, I'd be interested in hearing those.
Yep.
Yeah, okay.
Hey, so from the internet, John Garofano asks, do you run introduction cycles when you start a development block to induce the repeated bout effect, or do you just jump right in?
Most people that we work with are trained, if they came to us and were, coming off of a long training break, then yeah, we would probably do an introduction cycle. But for the most part, they've been training anyway. Maybe they've done a short deload, which would function as their pivot block anyway. So I don't find a need for me personally to do an introduction block most of the time. You certainly could. That wouldn't be a problem. Any other questions? Yeah.
So basically with this method, you're doing the same workout week to week until it stops working. So I guess my question is are you doing just the same RPE every workout for every set?
Yeah, so it's the same protocol. So I'll tell you to squat to a triple at a 9 RPE, and it'll be that every week, squat to a triple at a 9 RPE. Now, as you get stronger, the weight will get a bit heavier, but it's a small adjustment as you go forward, but it's to keep that RPE on target. Yeah. So another thing that I was really worried in the beginning that this would be boring, right? Like, man, it's just the same thing over and over. People are not going to like this. Well, I've had 0 problem with boredom. And it seems like as you're doing this and as those weights are going up and getting better every week, it's not boring. Now, when you hit that peak condition and now you're doing the same thing you've been doing for 8 weeks and now the weights aren't improving anymore, now it's suddenly boring. But it's also time to change stuff, so it works out. It's not a problem.
Hi, I see a lot of similarities to block periodization, but with an RPE approach and more flexible because you're using data from your athletes. But I do not see you talking about anything related to hypertrophy, because I think that's a big thing when you do block periodization. Can you talk a little bit about it?
So the long-term planning for this can start to look more like block periodization, but only really once you know the athlete a bit more. As if you know, hey, they take 4 weeks to peak and 1 week pivots, and I'm 15 weeks out from the competition. Well, you know that you've got 3 full training cycles before you can get to the competition. Well, in a case like that, maybe you set it up so that your early cycle is lower in intensity and then it goes up a little bit and up a little bit, but only if that corresponds to the athlete response. You can also, we've done this with a lot of our athletes, run hypertrophy blocks if they're far away from competition and you're basically looking for a somewhat of an off-season type of thing, and that seems to work really well. But you don't have to go about that. You don't have to go about it that way, and it's 100% contingent on what the athlete responds best to.
I'm wondering, when you find something that works, like you start this thing and it's a combination of things, how do you know what it is that's actually working, or does that not matter because it's the whole picture that's working?
Well, both.
Okay.
So it's kind of I guess kind of a Bayesian approach to it. So like for example, I said for me, pin presses seem to work well. How do I know that? Well, as I do these training blocks, let's say I do a training block and it contains pin press and it does well. Okay, well, that's a vote for pin press. And then I do another training block with pin press and it also does well. So I can be a little bit more sure that it's pin press, because the blocks are all different, but this one had high intensity and this one had low intensity. And so as you go forward, you basically say, you develop this picture that's like, man, every time I do pin press, it goes well. Every time I train, for me, with high intensities, it goes well. Every time Mike Carrazzo trains with high intensities, it doesn't go so well. So you're never certain, okay? But you get more certain with more data. Yes?
So you're saying, like, someone works with high intensity, someone works with a lower intensity. Like, how do you plan out different blocks? Like, do you just keep hammering high intensity forever with that person, or do you have to mix it up at times?
You will want to mix it up and try different things. So if you look at these guys who are, let's say these masters lifters who are still setting the world on fire, and you look at the training for a lot of them, let's take Dave Ricks as an example. If you talk to him about the training, it's the same training that he's ran since like 1986. It's just the same thing over and over. Well, I do 3 weeks of sixes, 3 weeks of fours, 3 weeks of triples, and then the meet. Like, it's the same thing, So, and I see that a lot. It's these guys, they found the thing that works for them and they just keep doing that. And also I'm sure there's some genetic predisposition to really thrive on one method for a long period of time, but it's in principle the same thing with what we're trying to do here. If you know that, hey, this type of training cycle works best for me, well, what if we can figure out 2 different types of training cycles that you respond well to, or even better would be 3. Then we can just kind of go between them and you get long-term results that way. Otherwise, you are left trying to explore a bit more until you can gather up those, 2, 3, 4, 2 or 3 would be nice, and that's usually where you're at. 2 or 3 different types of training block that work well for a particular athlete. So that's what you're kind of shooting for. We'll take one more and then we'll have to give you guys a break.
Just for the individual lifter, what what advice do you give for steps that you can take to have a better understanding about what does and doesn't work, whether you're working with the coach or not?
The absolute best thing that you can do is to keep a good training log. And so I heard that when I was a young lifter, and so I kept a notebook and I wrote down everything I did, and I still have all those, and I don't make any use of that. The important thing is to extract the information. So that's, and I know plugging the RTS training log again, but it's there for anybody to use for free. And the whole thing is designed to extract that information back out. So if you keep a good training log and then you run these block reviews, you'll be able to see those types of patterns. Even if you're not using specifically this type of method, it'll take longer for those patterns to emerge, but you'll still be able to see them. Just running the block reviews on every training block that you run, and then starting to develop that picture of, hey, what do all the successful ones have in common? Man, every time I have good performances, it's after a block where I did, medium intensity bench pressing, or maybe it's a certain exercise or a certain combination of exercises. But you start to form those pictures by being observant and paying attention to the things that you've done in training. Okay, so that's enough for now. Let's take a break, and let's take a 10-minute break, and then we'll have a short Q&A before lunch. So if there's more questions, we can get to them then. Thanks, guys.
Reactive training systems.